when should you suspect nasal foreign bodies? So first thing is when to suspect. Whenever there is a young child who is having unilateral purulent nasal discharge, because there will be frequently secondary superinfection along with unilateral nasal obstruction. Then you will suspect nasal foreign body. If the mother has seen, if a caretaker has seen, father has seen the child inserting a foreign body, then it is obvious. But many times children will insert nasal body and then they will roam around and will forget. So there will be no forthcoming history of the child having inserted actively. And so these are the areas whenever a child presents like this, you will suspect a nasal foreign body. Whenever you suspect a nasal foreign body, you will always perform an anterior rhinoscopy or a flexible fiber optic rhinoscopy. So you will get a ENT consultation, and many times to remove nasal foreign body you may sometimes have to perform a CT scan as well. Initially, whenever you are sure that there is a nasal foreign body, when you have to do management in case of treatment, we first try the non-invasive methods. In non-invasive methods, some of the things you need not write. Like if you find that there is a foreign body just in front, you will take a small forceps and remove it. The important point is many of these foreign bodies can be hygroscopic. They take up fluid. So never put a saline drops inside when you suspecting nasal foreign body, because that may swell up and cause further problem and cause complete obstruction in the nasal cavity. So water and saline should be avoided. If it is anteriorly visible and you can easily put a catheter or you can put small forceps, just take it out like this. In case it is slightly deeper lodged, you can perform a maneuver called as mother's kiss technique. Mother's kiss technique has been mentioned in Nelson. So what we do in mother's kiss technique is, suppose a child has put his foreign body in this part of the nasal side. This part is patent. So what mother will do is, or for that matter any caretaker, you will occlude the normal part completely. Then you will put your lips on the lips of the child, make a seal and strongly blow air into the oral cavity of the child. So when this strong pressure will go inside, this part is already occluded. So from the back pressure, the foreign body can come out. It has as high a success rate as 15 to 20%. That is almost 1/5 foreign bodies in the nasal cavity can be removed by the mother's kiss technique. But it should be maximally tried 2 to 3 times. Things to remember, it is effective only in a foreign body which is slightly, less hygroscopic, because if it is swollen and stuck, it will not come out by that. There should be a proper seal formed here, and the proper nostril occlusion is also important. If mother's kiss technique fails, you can go in for removal using special rhinoscopic procedures. In rhinoscopic procedures, we use a special catheter known as CADS catheter. It is mentioned in Nelson. So CADS catheter is used for removal of these foreign bodies. If that also fails, then you need to go in for surgery. For MCQ point, indications for surgical removal include if there is failure of non-surgical methods, if the age is more than 5 years, or if there is disc-shaped button battery. Disc-shaped button batteries have a problem of significant alkaline damage to the nasal mucosa. Third, we come to epistaxis in children. Bleeding from the nose is called as epistaxis, right? What is the most common age for epistaxis in children? The most common age for epistaxis is 3 to 8 years. Epistaxis can be divided into 2 parts. It can be primary, also known as idiopathic, which is most common, and then you can have secondary causes where there is an underlying cause. The secondary causes can have multiple reasons. It can occur due to infections like viral nasopharyngitis. It can occur due to chronic nose picking by the child. right? If the child has a habit of frequently putting fingers into the nose, so nose picking can cause. It can occur as serious epistaxis can occur in vascular malformations like hereditary hemorrhagic telangiectasias. It can occur in hemophilias. It can occur in von Willebrand disease. It can even occur in platelet disorders. There is a long list.